Welcome to a new episode of our weekly web series Science in Context. The number of cases with the Omicron sublineage BA.4 and BA.5 are growing worldwide. I'm Sabine, and joining me today is Professor Neil Ferguson. Neil, can you explain a bit more about these variants of Omicron?
We saw very large numbers of infections, and that of course gives the virus a chance to evolve, and we've seen a sequence of variants. The original Omicron we call BA.1, and since then many additional variants have risen. Two of concern at the moment are BA.4 and BA.5, because they're antigenically, that's immunologically slightly different from BA.1 and BA.2.
We're seeing waves of this BA.4 in South Africa and BA.5 in Portugal. Can we expect a wave in the UK?
So they have a slight advantage in different populations, and the exact balance of the advantage they have depends on exactly what vaccines have been used, the extent of natural infection in the past, and when they get seeded. Both seem to have a growth advantage compared with BA.2. which is still the dominant variant, so we're likely to see increasing infections. And indeed, if we look at the data coming out from the UK, allowing for the fact we're not doing as much testing as we used to, we're seeing increases in the number of people hospitalised with COVID infection.
Given the expected rise in COVID cases, what can we expect for winter in the UK, and what will the impact be on the NHS capacity?
Well, it's very difficult to make long-term predictions. As BA.4 and BA.5 rise in the coming weeks and months, we could expect some surge of hospitalisations, but I doubt it's going to be in any sense overwhelming. And the good thing is that deaths are still very, very low. But clearly we haven't had a big flu epidemic since before the pandemic. People's immunity to influenza will have dropped over that time. So we could expect, seeing what Australia is seeing now, to have a really larger than usual flu epidemic on top of almost certainly new COVID variants, which cause again some degree of pressure on the health service. Given the level of immunity to COVID we now have in the population thanks to vaccine and infection, I doubt it's going to be an overwhelming winter, but it still may be quite difficult.